News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. If you've suffered with depression, or you have a family member or someone that you care about who has suffered with depression, you'll want to watch our show today. We're going to have an excellent show where we take a look at what is depression, what are the symptoms of depression, how does it affect someone's life, that there is in fact help and hope, that people can get help to overcome their depression, and that there are resources in our community. I'm very glad that we have an expert guest with us today, Dr. Suat Yashar. Dr. Yashar is a board-certified psychiatrist who did his training in internal medicine and psychiatry at the University of Texas. Dr. Yashar has been practicing here in Northern Nevada since 2004, and he is one of the principals of Ascent Neurobehavioral Institute in Reno, Nevada. So, Dr. Yashar, it's so great to have you here with us for the show.
I'm delighted to be here today, Tom.
Thank you. Thanks, Dr. Yashar. So, depression, of course, has impacted so many people's lives so deeply, and it affects so many people's lives. Let me just start off asking you a general question. What can you tell us about depression?
Well, depression is a real disease, and it's a real painful situation where you hurt in an emotional way and in a physical way. You are in pain. And the definition by DSM-4, that is the Diagnostic Statistical Manual, is persistent, depressed or sad mood that is ongoing at least 2 weeks, along with difficulty of sleep, neurovegetative symptoms involving weight gain, weight loss, difficulty with paying attention, concentration, energy, suicidal thoughts, and so on. And it may be a recurrent problem and causes multiple dimensional problems in family, in social environment, and is a disabling condition, which will be the second most common reason for disability in the 2020.
Wow, that's amazing, the way it affects people's lives.
Right.
And as you were saying, it affects someone really throughout their lives, their relationships, their career, their self-esteem, their ability to function.
And depending on their role in the family, as a mother, their children get affected. As a father, their children get affected. And it's relevant to whole community.
Yes.
Because we live in an organic environment.
Yes. So, of course, we're in the 21st century now. People started talking about depression thousands of years ago.
Of course.
And, of course, you know, 150 years ago, Sigmund Freud. And what is our understanding in the 21st century of what depression is, Dr. Yashar?
Well, it's an interesting development. We talk about initially first the chemical imbalance, and different molecules came, serotonin, dopamine, norepinephrine, etc. And the genetic etiologies came, and we started doing neuroimaging studies and found that there is too much glutamate activity in the depressed state, in bipolar depression and the regular depression. Decrease GABA, which is another neurotransmitter activity in the occipital cortex.
So are these like PET scans or MRIs or?
MR spectroscopy. It's a technique which you can measure the chemicals in the brain. And also, I mean, there are some genes that are associated with the depression. There is the serotonin transporter gene, which has been discussed the most, and you inherit two different forms of that gene. One is the short version, the other is the long version. And if you have the long version, you can deal pretty much with the problems.
Uh-huh.
But you have the short version, and if you have adversaries in life, like childhood abuse, traumatic experiences, difficult jobs, and lots of stress, then you are prone to get depression.
Uh-huh.
And if you are female, it's even worse. The possibility of getting depression is almost 75 to 80%. Somebody who carries the transporter of serotonin,
Yeah.
Short version,
Yeah.
basically.
Well, Dr. Yashar, this is a great introduction, and right after this brief break, we want to come back and continue talking about the illness of depression and, as well as treatment and recovery from depression. Hello, and welcome back to New Skills for Living. You'll see up on your screen, down at the bottom there, is the website, easeap.com. And if you go to that website, you'll be able to see Dr. Yashar's interview and let other people know about Dr. Yashar's interview. That'll be available on that website on streaming video, as well as 20 or 30 other television shows that we've done in the past few years that deal with depression and anxiety and recovery from addictive disorders. So please go to that website for Dr. Yashar's interview, as well as others. And then also, let me remind you, those of you that have watched the show, or if this is your first time, if you go to that website, there are also over 80 newsletters that you can access. You can read, you can print them, you can send them and share them to other people. And these newsletters address stress, anxiety, depression, relationships, all kinds of life skills type topics. So let's continue on now talking with Dr. Yashar about depression. And again, with his experience as an internist, as a board-certified psychiatrist, we've got a real chance today to learn about the treatment, the 21st century treatment of depression. So, Dr. Yashar, you brought this visual aid here on the table that kind of, can you tell us a little bit about what this visual aid is saying? Yeah.
It just shows the organicity of the depression and how it really is a physical illness. And this is basically two PET scan images. One is the normal PET scan image, and the other is the depressed. The blue one shows the hypoactive areas of the brain in the depressed state. That's the reason we cannot concentrate, we cannot think clearly, or we feel low in energy in the depressed state.
So the brain is not functioning properly.
Of course, of course. And the reason for that is a hormone called brain-derived neurotrophic factor. It's basically a juice for the nerve cells, just like the water for plants. Without the BDNF, brain-derived neurotrophic factor, the neuron starts to get shrinkage. And the mechanism that causes that shrinkage is stress, inflammation, and too much glutamate. The glutamate, increased glutamate happens with the trauma experiences, too much agitation, or with the alcoholism or sedative hypnotic use. Initially your brain gets depressed, and then when those substances removed from the brain, it comes as too much glutamate, and it creates a cascade of chemicals in the brain that leads to neuronal death and shrinkage. And TMS is a quite contemporary treatment of the 21st century, which I'm delighted to talk today about. And it's a way of bringing those shrunken nerve cells back, creating new synapses. Basically, TMS is a magnetic device, and it is a coil which creates an alternating magnetic impulse, and it leads to electrical current in the adjacent conductive tissue. And in this case, that is the brain. So there are two different ways of modulating the brain. One is stimulation by creating 10 hertz per second, and the other is the 1 hertz, which calms the brain. So we have usage for both. One is you can, in the depressed state, just like those blue areas that we saw, it just creates more activity in the dorsolateral prefrontal cortex area.
Yes. So Dr. Yashar, you began talking about TMS, which of course is transcranial magnetic stimulation,
Right.
which is a 21st century therapy for depression. And we really want to do this topic justice. So the whole next segment, we're going to be talking about TMS and what a revolutionary and powerful therapy this is for people suffering with depression. We'll see you right after this brief break. Hello and welcome back to New Skills for Living. We're talking with Dr. Suwat Yashar about dealing with depression and especially transcranial magnetic stimulation. Now, of course, we've heard for years about medications and therapy and lifestyle change. And this is another therapy, a very powerful therapy that I really wanted us here in Northern Nevada to be exposed to. Dr. Yashar at Ascent Neurobehavioral Institute, they have the only TMS clinic in Northern Nevada. And it's a great resource for our community. So I'd really like Dr. Yashar to tell us more about how does TMS work in people's lives.
Sure. I'm delighted to be introducing TMS or transcranial magnetic stimulation to Reno area because it's a local treatment, it's safe, nothing goes into your body. It's almost, in that sense, holistic.
Yes.
And I associate it into some sort of rehab or bodybuilding.
Uh-huh.
And it's a quite effective treatment. There's a recent study which showed 50 consequential patients who received TMS, and the response to depression was 90%.
Wow.
And remission was 70%.
Mm-hmm.
Of course, along with the biopsychosocial.
Now, when you say remission, what is remission?
Remission criteria is less than 5 in one of the criteria, which is QIDSR-16 that we use, or less than 10 in back depression inventory, or 1 or 2 from the clinical global impression scale. And this is these patients were treatment-resistant patients, failed 4 antidepressant trials, and they went into remission or responded. And this is a great consequence with a modality which doesn't have significant side effects. The only side effect that you experience from the TMS is scalp pain that may happen in 30% of the patients, and it responds to regular non-steroid anti-inflammatory or regular painkillers. And it may be a great therapy for pregnant patients, nursing patients, or who are experiencing significant sexual side effects from the SSRIs, which is quite common in women, almost 70%. And it's also great for cognition. It doesn't have cognitive side effects. And by increasing that dorsolateral prefrontal cortex activity and associated limbic circuitry, it provides a soothing environment for that limbic storm, and it is great for attention concentration. So I am very delighted with the results of that recent study published in the APA meeting in this May.
In fact, up on our screen right now is a picture of what the TMS therapy. Can you describe that a little bit, Dr. Yashar, like up on our screen?
Of course. It's you sit on to a dentist chair, basically, and there's a coil which sits on the lateral side of the brain, dorsolateral prefrontal cortex, most of the time left-sided, but it might be right-sided as well. And there is no anesthesia or nothing required. You can drive your car into the treatment,
Yes.
and then leave the treatment, driving your car back, and there is no associated suicide risk. So when you have concerns about the teenagers or the adults less than 24-year-old, which most of the antidepressants and antipsychotics are carrying black box warnings for the suicidality, this doesn't carry that suicidality warning. So it can be applied to those age group, and it's been successfully applied to even the 92 years old. In that study, the oldest
92.
one was
Wow.
92
Wow.
and responded very well. And basically, what you feel is a tap sound here on the dorsolateral prefrontal cortex, and nothing actually taps there. It's just like an fMRI-like technique, which you just feel the click of it. And it's similar to MRI technology, and same power is used.
Okay. Well, so in summarizing this segment, it sounds like with TMS, Dr. Yashar, that it's clinically very effective in helping people with depression.
Yes.
There are virtually no side effects, and that's what makes it a real powerful therapy for people. And so we're going to take a brief break, and we're going to continue talking about recovery from this terrible illness. Hello, and welcome back to New Skills for Living. As we're continuing to talk about depression and the treatment of depression, in this segment we're going to especially focus in on hope, that there is hope for a new life. And we're also going to talk about resources. Of course, I would like to mention one of the resources is Dr. Yashar's practice at Ascent Neurobehavioral Institute. And when Dr. Yashar is talking, you'll see the website come up under his name, as well as the telephone number if you'd like to contact Dr. Yashar, or his wife, who is the other Dr. Yashar. She's also involved in the practice. So, Dr. Yashar, would you want to go ahead and talk with us about that very important topic of hope, that there is hope and there is help?
Yes, I am very impressed by the results of this transcranial magnetic stimulation. And it's an under-promised and over-delivered treatment with great consequences. And it has many other applications which I don't have time to discuss about. It may work with when you apply on the right side for anxiety, panic attacks, post-traumatic stress disorder, generalized anxiety, or even alcohol cravings, cocaine cravings, or in different places it may work for terrible tinnitus. So we come with a very different, very contemporary option of treating depression with minimal side effects. No seizures reported, maybe 10,000 or more stimulation sessions, and so far all the patients in my practice are getting better, and that also is great. But there are other ways of helping people. Diet is important, a Mediterranean diet, vitamin E, C, dealing with stress, and also working regular exercise, mindfulness practices. All of those are important. And talking to your NAMI for support, family interactions, social interactions, they are all great ways of dealing with depression. And we made a great breakthrough for treatment, I believe, with the transcranial magnetic stimulation.
So, Dr. Yashar, to hear you talk about that treatment, you really take a holistic approach then in working with your patients. Can you tell us a little bit more about that, please?
Of course. My approach is biopsychosocial, and most of the time we offer patients the group therapies, the individual psychotherapies, mindfulness practices, improving the family dynamics, and addressing all the relevant areas. I'm an internist. Most of the time see in a different view as well,
Yes.
with the multiple organic levels, and that's a good skill to have.
Yeah,
I
that
think.
sure is.
Yeah,
That sure is.
and so, and I also motivate my patients to do the skills like you taught in the ACT program.
Yes,
That's,
yes.
those are great.
Yeah. And
skills
so,
to
yeah,
have.
so Dr. Yashar, I hear you saying, too, along with your holistic approach,
Right.
you're very encouraging for people. It's very
Of
empowering
course.
to really take their life back and take
Mhm.
control of their life. Am I hearing you correctly?
Of course, of course. I act like a coach.
Uh-huh.
And
Yes.
and it's a place for rehabilitation.
Yeah.
And,
Now-
and when I say that, it's like it's not any different than providing like a 24-hour gym experience.
Uh-huh. Uh-huh.
And,
You know, one of the things that you
uh-huh.
mentioned today that I found to be so impressive about TMS is those patients who had been on at least 4 antidepressants, but they were still severely depressed.
received the biopsychosocial
Yeah,
model
yeah.
and were
But-
still depressed.
But that they received TMS treatment and their depression was alleviated.
Right. And there's an interesting synergy between therapy, medications, and TMS. TMS, when there's the TMS, stimulates the brain. Prior to that, the pathways are narrow. They don't carry the transmitters. Patients cannot concentrate on therapy. And when the TMS happens, and when you add the medications, it's like those narrow pathways open to turn into highways, and that's a great way of including therapy,
Yes.
exercise, social interactions, and biological modalities
Yes.
and medications.
Yes, I can hear that, Dr. Yashar. So up on your screen, you'll see the information there, easeap.com. And Dr. Yashar's interview from today will be up there on the website if you'd like to watch Dr. Yashar again or let your family and friends know about that. Dr. Yashar, we want to thank you so much for coming and sharing your wisdom and your experience and your expertise, and we hope to have you back another time.
Thank you. I really enjoyed it.
All right,
Thanks a
Dr.
lot,
Yashar.
Tom.
And thank you all for joining us. We'll see you next month.